12 most common warning signs of schizophrenia. Schizophrenia is a serious mental health disorder that affects how a person thinks, feels, and behaves. Symptoms usually begin in the late teens to early 30s, though they can occur earlier or later. Early recognition and treatment can significantly improve long-term outcomes. Here are 12 of the most common warning signs. 1. Hearing voices, auditory hallucinations, hearing people talking or commenting when no one is there. 2. False beliefs, delusions, strongly believing things that are not true, such as being watched, followed, or having special powers. 3. Disorganized thinking. Speech may become difficult to follow, jumping from one topic to another without logical connections. 4. Social withdrawal, pulling away from family, friends, work, or school. 5. Loss of motivation, difficulty starting or completing everyday tasks. 6. Reduced emotional expression, showing little facial expression or speaking in a flat monotone voice. 7. Poor personal hygiene, neglecting bathing, grooming, or changing clothes. 8. Difficulty concentrating, trouble focusing, remembering information, or making decisions. 9. Suspicion or paranoia, feeling that others are trying to harm, deceive, or spy on them. 10. Unusual behavior, acting in ways that seem odd, unpredictable, or inappropriate for the situation. 11. Sleep disturbances, sleeping too much, too little, or having major changes in sleep patterns. 12. Changes in work or school performance, sudden decline in grades, job performance, or ability to function. How is schizophrenia diagnosed? There is no single blood test or brain scan that diagnoses schizophrenia. A mental health professional, usually a psychiatrist, makes the diagnosis by conducting a detailed psychiatric interview, reviewing symptoms and medical history, speaking with family members when appropriate, performing a physical examination, ordering laboratory tests to rule out other medical conditions, sometimes ordering brain imaging if another neurological condition is suspected. According to the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, symptoms generally must last at least 6 months, with at least 1 month of active symptoms, significantly interfere with work, school, relationships, or self-care. Not be better explained by substance use or another medical condition. Is schizophrenia inherited? Genetics play an important role, but schizophrenia is not caused by genes alone. Risk increases if a close relative has schizophrenia. General population, about 1% lifetime risk. One parent with schizophrenia, about 10%. Identical twin with schizophrenia, up to 40–50%. Researchers believe schizophrenia develops from a combination of genetic predisposition, differences in brain development and chemistry, environmental factors. Possible environmental contributors include pregnancy or birth complications, viral infections during pregnancy, severe childhood trauma or stress, heavy cannabis use during adolescence in genetically susceptible individuals. Having a risk factor does not mean someone will develop schizophrenia. How is schizophrenia treated? Although schizophrenia is a lifelong condition, many people improve significantly with treatment. Treatment usually includes 1. Antipsychotic medications. These are the primary treatment and help reduce hallucinations, delusions, and disorganized thinking. 2. Psychotherapy, cognitive behavioral therapy, CBT, family therapy, supportive counseling. 3. Social skills training helps improve communication, relationships, and daily functioning. 4. Supported employment and education programs that help people return to work or school. 5. Coordinated specialty care, a team-based approach that combines medication, therapy, family education, and vocational support, especially for people experiencing a first episode of psychosis. Can people recover? Many people with schizophrenia can live independently, maintain jobs, have meaningful relationships, attend school, enjoy a good quality of life. The best outcomes are associated with early diagnosis, taking medications as prescribed, regular therapy and support, strong family and community support, avoiding alcohol and recreational drugs, This information is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. If someone is experiencing hallucinations, delusions, thoughts of self-harm, or appears to be a danger to themselves or others, seek immediate medical attention or contact emergency services. Early evaluation by a qualified healthcare professional can make a significant difference in treatment outcomes. If you found this video helpful or learned something new, please take a moment to like, comment, and share it with someone who could benefit from this information. Your support helps us reach more people with reliable health education. Don't forget to subscribe and turn on notifications so you never miss our latest videos on medical conditions, treatments, and practical health tips. Thank you for watching, and we'll see you in the next video. Stay informed, stay healthy, and take care of yourself.